I was looking at a synopsis of journal articles today and I saw something that was interesting. It was a study on kids that use small screen devices like smartphones or tablets. Now, I am not a pediatrician, but I notice a lot of my patients that have children, it really looks to me like smartphones and tablets are the new pacifiers. As you may know, I don't like electromagnetic field exposure. So I definitely don't think that small children should be playing around with an active cell phone. Now, if they're viewing stuff that's been downloaded onto the device and it's on airplane mode, I think that's much less harmful. But listen to this study that was published recently in the journal Pediatrics. Now, in this study, investigators evaluated over 2,000 4th and 7th grade students in Massachusetts. The mean age was about 10 years old. The study showed that the children who slept near the small screen light-emitting device in their room had statistically significant fewer minutes of sleep and later bedtimes than the children that even had a TV in their room. Now, the study showed that, in fact, the presence of these small screen devices impacted a child's sleep patterns more than a TV did. The kids with the devices had a full 20 minutes less sleep on weekdays than those that didn't. Now, do you think 20 minutes of less sleep will affect a kid? Well, I think so. Now, we know that the blue light from these devices destroys melatonin in the brain, which is important for sleep and optimal immune function. Many studies also show that electromagnetic radiation from these devices does have biologic effect. And some of these biologic effects are bad. So there's two really good reasons not to let your kids have one of these things in the bedroom. Now, does this only affect kids? Well, of course not. Another study that was recently reported, this was conducted at Brigham and Women's Hospital in Massachusetts and published in the Proceedings of the National Academy of Sciences, compared using a light-emitting reader such as an iPad versus reading an actual book. Now, there was a significant reduction in melatonin and the quality of sleep in those using the lighted e-readers. The light-emitting user took longer to fall asleep and was more tired the next day, even if they slept the same number of hours as the book readers. So what can you do? Well, get these evil devices out of your bedroom. That's what you can do. Get a real book with actual pages. Now, if you're under 30, I have one right here just to show you. They look like this. A real book. Now, if you want good sleep, which is critical for good health, you must reduce blue light at night. And remember, white light contains blue light. Now, sleep is where our brain and nervous system repairs itself from the stress of the day. Without this repair, our health starts to go downhill and we develop the modern diseases that plague the patients that I see in my practice and our whole society. Now, are there other options? Well, download the information on the device and don't let it receive a transmission from a cell tower or a wireless connection. You may be able to safely use the device then, but if you need the blue light blocked, there's an app for Android. If you have iOS, you can buy a screen that goes over that blocks blue light. Or for computers, there's Flux. This is a program that filters blue light. I actually use amber glasses. I have some that fit over the top of these. And I wear them. It blocks all the blue light from the screens I'm looking at, plus the light bulbs above my head and any other lights if people are shining flashlights in my eyes or whatever. It blocks it all. So I got it covered. I look like a geek, but who cares? Now, if you like this kind of information that's critical for your health, please subscribe to our channel. This is Dr. G. Thanks so much for watching.